Hello all, welcome back. So we are going to discuss ECG, that is electrocardiogram. But to discuss ECG, first of all we have to understand the cardiac physiology, especially the generation and conduction of impulse. Okay, so first of all, every cardiac cell has an inherent property of spontaneous depolarization. Okay, that is called impulse generation. Okay, so all the cardiac cells have that property, but SA node is the most prominent to produce that impulse with high beats per minute, that is high firing rate. Okay, so SA node is the that's why SA node is called pacemaker of the heart. So first of all, impulse is generated in SA node. Okay, it fires at the rate of 60 to 100 per minute. 100 beats or impulses per minute. That's the normal heart rate of a person. Okay, so as you can see, this is the SA node. Okay, so from SA node, impulse starts, it goes into the bilateral atria together. Okay, so it goes in both the atria together. From SA node to AV node, it goes to the right atrium using the bundle of Batchman. Okay, so this is important. This bundle is important. From SA node to AV node, it goes using bundle of Batchman. It goes to the AV node and bundle of his together. Okay, so this is clear. So it goes from here in this bundles. Okay, it reaches the AV node. From AV node and bundle of his, it goes into the bundle branches, which are two types: right bundle branch and left bundle branch. Left bundle branch is divided into two parts. Okay, the one part is anterior, one part is posterior. Anterior one is on the left side and the posterior one is on the right side. Okay, from this bundle, so these are the bundle branches. From this bundle branches, it goes to the bilateral ventricles together. Normally both the ventricles will be stimulated together by the impulse. Okay, simultaneously. It goes to the ventricles from bundle branches using Purkinje fibers. Okay, so this is clear. This is the normal conduction of a impulse from SA node to the ventricles. And as you can see, this is a bundle branch. Here there will be Purkinje fibers, and Purkinje fibers will again from the apex of the heart. This is the apex. This is apex and this is the base of the heart. That's what we call it. That's the nomenclature that we use. So from the apex again it goes in the reverse direction to the base of the heart. So to depolarize the whole ventricle. So this is normal conduction. Now we have to remember the rate or the firing rate by all the cardiac cells. Okay. So for example, SA node is firing at the rate of 60 to 100 per minute. Okay, this is the most like highest rate. Okay, that's why it becomes the pacemaker. After that there is AV node and BOH, that is bundle of his. They fire at the rate of 40 to 60 per minute. And then there is Purkinje fibers that fire at the rate of 25 to 40 per minute. Okay, so as you can see, SA node is firing at the highest rate. That's why it becomes the pacemaker. But in any case, if SA node is not working, any reason it may be, then AV node takes up the function of producing the impulse and passing on to the ventricles, because it is important to beat the heart. Then one more thing you have to understand is the speed of conduction through all the cells. Okay, so it's easy to remember. All the cardiac myocytes, that is atria and ventricles, through that the speed of conduction of the impulse, okay, is 0.5 meter per second. Okay, through the AV node it is 0.05 meter per second. This is the slowest one. Okay, so this is called AV nodal delay. This delay is important to let the atria contract. So where first of all atria will depolarize, then the impulse will go into the AV node. So AV node has this delay. It takes more time than the normal than the other cells. Okay, so that time is required for atria to contract, after which AV node will pass on the impulse to the ventricles and then ventricles will contract. So this differentiate the contraction of, like, there is a time period, there is a difference of time between atrial contraction and ventricular contraction which is needed normally. Otherwise, if this delay is not there, or if AV nodal like the speed of the conduction from AV node increases, okay, then it can lead to contraction of atria and ventricles together, and it can be a problem because there can be different pressure gradients. Okay, so AV nodal delay is important. From AV node, and it goes to the bundle branches. Bundle branches, the speed of the conduction is around 2 meter per second. And then there is Purkinje fibers. So Purkinje fibers has the maximum speed of conduction up to 4 meter per second. Okay. So after bundle branch, Purkinje fibers have the maximum in throughout the heart. Purkinje fibers have the highest rate of highest speed of conduction. Okay. So I hope this is clear. Now we will discuss cardiac muscle action potential. Okay, so this is actually ventricle muscles action potential. Okay, basically we have to understand this to understand ECG further. So as you can see, always remember the first phase of depolarization. Okay, so there is a phase 0. It's a phase of depolarization. Okay, now what is depolarization? Depolarization. So normally sodium channels are outside, potassium channels are inside, intracellular. Okay, depolarization is when sodium channels open up. Okay, if there is any stimulus and sodium channels open up and sodium goes inside the cell. Okay, so inside the cell, that is the membrane of the cell, the inside of the membrane of the cell will become positive. This positivity is called as depolarization, and it is needed especially in the muscles, or especially in the muscles for the contraction. Okay, so here there will be Na plus channels opening. Okay, and Na plus will go inside the cell, and it, as you can see, so this is the resting membrane potential, that is actually phase 4 that we'll discuss later on. This resting membrane potential for ventricular muscle cells are minus 90 millivolt. Okay, so when minus 90 millivolt, now the cardiac myocytes will get the impulse from the Purkinje fibers, especially ventricles, right? So that impulse, when it gets, it opens up the voltage gated sodium channels. Okay, now that voltage gated sodium channels open up, so positivity increases, it goes up to minus plus 50 millivolt. Okay, from plus 50 millivolt, when it reaches, there is one channel, there is a phase 1 will now understand, slow K plus channels open up. So as I told you previously, that potassium is more inside the cell. So when K plus channels open up, K plus goes from inside the cell to the outside. So as you can see, positive ion is going outside. So it will lead to negative. Okay, so that's why the action potential decreases, that amplitude decreases. So this is phase 1. Now when it at certain stage of this action potential, calcium channels will open up in the cardiac myocytes. Okay, so that is responsible for phase 2. Calcium channels will open up, and there will be again, calcium channel is more outside the cell. So from the outside of the cells, that extracellular to intracellular compartment, calcium channels will go. Okay, so there is a competition here, there is a competition between K plus and calcium, and that leads to, so K plus is going outside, calcium is going inside, so it leads to a plateau stage. This is called as plateau stage. Okay, in next video we will also discuss how this is correlating with the ECG. Okay, then there is phase 3. So now at certain point again, calcium channel will close, and then some fast potassium channels along with this slow potassium channels will open up, and there is a fast efflux. Okay, fast efflux of K plus. So this again leads to negative amplitude. Okay, so negative, it goes into the, it reaches the resting membrane potential. So basically these potassium channels are responsible to bring the cardiac myocyte back to resting membrane potential, that is up to minus 90 millivolt. Okay, and that is phase 4. So this is phase 3 is the phase of repolarization. And phase 4 is RMP, that is resting membrane potential. So this resting membrane potential is different for different muscles. For cardiac myocyte, it is around minus 90 millivolt. Okay, so this is important to understand the basic physiology of heart, and this will also help you to understand the ECG. Okay, so phase 0 is depolarization, phase 1 is the negative stage, okay, phase 2 is the stage of plateau, phase 3 is the repolarization phase, okay, and phase 4 is the RMP. So if they ask you a question, which channels are responsible for resting membrane potential, it will be K plus channel. This resting membrane potential, how does it occur? So now potassium is outside and sodium is inside. Okay, at this stage potassium is outside, sodium is inside. So we have to bring that equilibrium back. Okay, that resting membrane potential back. So potassium has to come inside and sodium has to go outside. So how does this? This is by Na plus K plus ATPase pump. Okay, so as you have read about Na plus K plus ATPase, so Na plus will bind the intracellular part of this pump and K plus will bind extracellular part of this pump and it will rotate 180-degree. Okay, and that's how potassium channels come back to the inside the cell and sodium channel goes outside the cell. Okay, so this is resting membrane potential. In the next video, we'll actually start ECG, proper ECG. This is just the basic to understand those lectures. Thank you.